Question 121. A 35-year-old Latin American client wishes to lose weight to reduce her chances of developing heart disease and diabetes. The client states, "I do not know how to make my diet work with the kind of foods that my family eats." What should the nurse do first to help the client determine a suitable diet for disease prevention? A. Provide her with copies of the approved dietary guidelines for the American Diabetic Association and the American Heart Association. B. Ask the client to provide a list of the types of foods she eats to determine how to best meet her needs. C. Provide a high-protein diet plan for the client. D. Provide the client with information related to risk factors for heart disease and diabetes. Answer B. Explanation. Assessment is the first step. Assessing what the client eats helps the nurse determine a plan for dietary recommendations based on the ADA and AHA guidelines. Providing the client with a copy of the guidelines is important, but is not the first priority. Based on the client's wish to reduce her chances of heart disease and diabetes, a high-protein diet plan might not be appropriate. Providing information to the client related to risk factors for heart disease and diabetes is important, but is not the first step. Health promotion and management. Question 122. A client is giving an opiate drug for pain relief following general anesthesia. A client becomes extremely somnolent with respiratory depression. The physician is likely to order the administration of A. Naloxone, Narcan, B. Labetalone, Normodine, C. Neostigmine, Brostigmine, D. Thiothixana, Nasava. Answer B. Explanation. Tolerance is the capacity of ingest an increased amount of a substance without effect and the experience of decreased sensitivity to the substance. Tolerance can develop with long-term use of many drugs. Choice 1 is the dose required to produce a defined magnitude of drug effect. Choice 3 binds to a receptor and causes an action. Choice 4 is the maximal response produced by a drug. Pharmacological therapies. Question 123. The nurse is teaching a client about erythema infectiosum. Which of the following factors are not correct? A. There is no rash. B. The disorder is uncommon in adults. C. There is no fever. D. There is sometimes a slap face appearance. Answer B. Explanation. Fifth disease, erythema infectiosum, is uncommon in adults. All the other statements are incorrect. Safety and infection control. Question 124. In conducting a health screening for 12-month-old children, the nurse expects them to have been immunized against which of the following diseases? A. Measles, polio, pertussis, hepatitis B. B. Diphtheria, pertussis, polio, tetanus. C. Rubella, polio, pertussis, hepatitis A. D. Measles, mumps, rubella, polio. Answer B. Explanation. By 12 months of age, the child should not have D, TA, B, and polio. MMR is not administered until a child is 12 months of age. Health promotion and maintenance. Question 125. A client states, "I eat a well-balanced diet. I do not smoke. I exercise regularly, and I have a yearly checkup with my physician. What else can I do to help prevent cancer?" The nurse should respond with which of the following statements? A. Sleep at least 6 to 8 hours a night. B. Practice monthly self-breast examination. C. Reduce stress. D. All of the above. Answer D. Explanation. All of the choices are methods of preventing cancer. Sleep is important in maintaining homeostasis, which helps the body respond to disease. Monthly breast examination can indicate cancer or fibrocystic disease. The body has a physiological response to stress that can decrease the immune response and increase the risk of disease. Health promotion and management. Question 126. A 65-year-old female client is experiencing post-menopausal bleeding. Which type of physician should this client be encouraged to see? A radiologist, B. a gynecologist, C. a physiatrist, D. an oncologist. Answer B. Explanation. A gynecologist is the physician who treats and manages disease of the female reproductive organs. A radiologist evaluates X-rays. A physiatrist is the physician manager of a rehabilitation team. An oncologist treats clients with cancer. Coordinated care. Question 127. Which of the following observations is most important when assessing a client's breathing? A. Presence of breathing and pulse rate. B. Breathing pattern and adequacy of breathing. C. Presence of breathing and adequacy of breathing. D. Patient position and adequacy of breathing. Answer C. Explanation. It is not enough to simply make sure the client is breathing. The client must be breathing adequately. Physiological adaptation. Question 128. Several passengers aboard an airliner suddenly become weak and suffer breathing difficulty. The diagnosis is likely to be A. Outbreak of avian flu, B. Chemical exposure, C. Bacterial pneumonia, D. Allergic reaction. Answer B. Explanation. The most likely cause of groups of individuals suddenly experiencing similar signs of illness all at once is a chemical exposure, safety, and infection control. Question 129. The nurse observes bilateral bruises on the arms of an elderly client in a long-term care facility. Which of the following questions should the nurse ask this client? A. How did you get those bruises? B. Did someone grab you by your arms? C. Do you fall often? D. What did you bump against? Answer B. Explanation. Using a direct approach is best when asking about suspected abuse. Clients are reluctant to report abuse because of shame and fear of reprisal. Psychosocial integrity. Question 130. In performing a psychosocial assessment, the nurse begins by asking questions that encourage the client to describe problematic behaviors and situations. The next step is to elicit the client's A. Feelings about what has been described, B. Thoughts about what has been described, C. Possible solutions to the problem, D. Intent in sharing the description. Answer B. Explanation. Questions should be asked in a precise order, specifically from the most simple description to the more difficult disclosure feelings. When the problems have been described, eliciting the client's thoughts about the dilemmas provides further assessment data as well as the client's interpretation of what has happened. Feeling solutions and articulating intent are more complex processes. Psychosocial integrity. Question 131. A 12-year-old male is brought to his primary care provider to determine whether sexual abuse has occurred. The mother states because there is no permanent physical damage, he does not need any more treatment. The nurse's response should be based on which of the following pieces of information? A. Male victims of sexual abuse seldom have long-term psychological problems. B. Survivors of male sexual abuse might become confused about their sexual identity. C. Unless treated, all male sex abuse survivors grow up to abuse other children. D. All children who have been sexually abused have the same needs, regardless of gender. Answer B. Explanation. Male children are sexually abused nearly as often as female children. Perpetrators are usually men but can be women. Needs of male children who have been sexually abused might be different from the needs of female survivors. Male survivors might respond in danger, question their sexuality, use alcohol or other drugs, and might try to prove their masculinity by performing daring acts. Psychosocial integrity. Question 132. What significant event occurs in the orientation phase of a nurse-client relationship? A. Establishment of roles. B. Identification of transference phenomenon. C. Placement of the client within the client's family structure. D. Client agreement that the nurse has the authority in the relationship. Answer B. Explanation. Transference phenomena are identified in relationships with authority such as physicians and nurses. Common positive transferences include desire for affection and gratification of dependency needs. Common negative transferences include hostility and competitiveness. These transferences must be recognized and resolved before growth and positive change can be undertaken in the working stage. Psychosocial integrity. Question 133. Which of the following ethnic groups is at highest risk in the United States for pesticide-related injuries? A. Native American. B. Asian Pacific. C. Norwegian. D. Hispanic. Answer D. Explanation. Because Hispanic people represent a large percentage of migrant workers in the United States. Many work in agriculture settings and might be exposed to pesticides, putting them at higher risk than the other groups. Safety and infection control. Question 134. The nurse wishes to decrease a client's use of denial and increase the client's expression of feelings. To do this, the nurse should A. Tell the client to stop using the defense mechanism of denial. B. Positively reinforce each expression of feelings. C. Instruct the client to express feelings. D. Challenge the client each time denial is used. Answer B. Explanation. The nurse should positively reinforce each expression of feelings. Psychosocial integrity. Question 135. A corporate executive works 6,080 hours a week. The client is experiencing some physical signs of stress. The nurse teaches the client biofeedback techniques. This is an example of which of the following health promotion interventions? A. Structure. B. Relaxation technique. C. Time management. D. Regular exercise. Answer B. Explanation. Biofeedback techniques can be used to quiet the mind, release tension, and counteract responses of general adaptation syndrome or stress syndrome. Nurses teaching relaxation techniques should encourage use of these techniques in stressful situations. Psychosocial integrity. Question 136. The focus of a nurse case manager is A. Nursing care needs at discharge. B. The comprehensive care needs of the client for continuity of care. C. Client education needs upon discharge. D. Financial resources for needed care. Answer B. Explanation. By definition, case management is a process of providing for the comprehensive care needs of a client for continuity of care throughout the health care experience, coordinated care. Question 137. A 17-year-old female was raped by a young man in her neighborhood. She is in the emergency department for evaluation and test. After the procedure is completed, a rape crisis counselor, nurse specialist, talks to the client in a conference room regarding the rape. Implementing counseling by the nurse specialist for the rape victim represents A. Assessment, B. Crisis intervention, C. Empathetic concern, D. Unwarranted intrusion. Answer B. Explanation. Choice 2 is part of the crisis intervention model. Counseling by a nurse specialist at the time of a stressful event, rape, can strengthen the client's coping. A nurse specialist in rape crisis intervention is educationally prepared in counseling and crisis intervention specific to rape victims, coordinated care. Question 138. An elderly client denies that abuse is occurring. Which of the following factors could be a barrier for the client to admit being a victim? A. Knowledge that elder abuse is rare. B. Personal belief that abuse is deserved. C. Lack of developmentally appropriate screening tools. D. Fear of reprisal and further violence if the incident is reported. Answer D. Explanation. Barriers to reporting elder abuse include victim shame, fear of reprisals, fear of loss of caregiver, and lack of knowledge of agencies that provide services. Many elders fear that reporting abuse results in their replacement in long-term care because the current caregiver is the abuser. Choices 1 and 3 are incorrect. Choice 2 might be true, but is not the best choice. Psychosocial integrity. Question 139. The death of a beloved spouse places the surviving partner in which type of crisis? A. Metro-national, B. Reactive, C. Non-reactive, D. Situational. Answer D. Explanation. A situational crisis is an unexpected, unplanned event such as the death of a spouse. Option 1 is a normal metro-rational crisis. Choices 3 and 2 are not recognized crisis states. Coordinated care. Question 140. At what point in the nurse-client relationship should termination first be addressed? A. In the working phase, B. In the termination phase, C. In the orientation phase, D. When the client initially brings up the topic. Answer C. Explanation. The client has a right to know the parameters of the nurse-client relationship. If the relationship is to be time-limited, the client should be informed of the number of sessions. If it is open-ended, the termination date is not known at the outset, and the client should know that this is an issue that is negotiated at a later date. Coordinated care. Question 141. The drug of choice to decrease uric acid levels is A. Prednisone, cortisone, B. Allopurinol, xylobrin, D. Indomethacin, indocin, D. Hydrochlorothiazide, hydroxyurea. Answer B. Explanation. Allopurinol is a drug used to treat gout, and it decreases uric acid formation. Prednisone is a corticosteroid used to decrease inflammation. Indomethacin is an analgesic, anti-inflammatory, and antipyretic agent. Hydrochlorothiazide is a thiazide diuretic used to treat hypertension and edema. Physiological adaptation. Question 142. Support system enhancement includes all of the following except A. Determining the barriers to using support systems, B. Discussing ways to help with others who are concerned, C. Exploring life problems of the support team members, D. Involving spouse, family, and friends in the care and planning. Answer C. Explanation. The exploration of life problems of support team members is not necessary to enhance the support system. Choices 1, 2, and 4 are all enhancements for a support system. Psychosocial integrity. Question 143. The intent of the Patient Self-Determination Act (PSDA) of 1990 is to A. Enhance personal control over legal care decisions. B. Encourage medical treatment decision-making prior to need. C. Give one federal standard for living wills and durable powers of attorney. D. Emphasize client education. Answer B. Explanation. The purpose of the PSDA is to promote decision-making prior to need. Choices 1, 3, and 4 are incorrect. The focus of the PSDA is individual healthcare decision-making. A federal standard for advanced directives does not exist. Each state has jurisdiction regarding these policies and protocols. Coordinated care. Question 144. A 4-year-old client is unable to go to sleep at night in the hospital. Which nursing intervention best promotes sleep for the child? A. Turning out the room light and closing the door. B. Tiring the child during the evening with play exercises. C. Identifying the child's home bedtime rituals and following them. D. Encouraging visitation by friends during the evening. Answer C. Explanation. Preschool-age children require bedtime rituals that should be followed in the hospital if possible. Choice 1 increases a child's fear. Choice 2 and 4 do not promote sleep, basic care and comfort. Question 145. In a disaster situation, the nurse assessing a diabetic client on insulin assesses for all of the following except A. Diabetic signs and symptoms. B. Nutritional status. C. Bleeding problems. D. Availability of insulin. Answer C. Explanation. Bleeding problems are not characteristic of diabetes. All the other options are appropriate areas of assessment, safety, and infection control. Question 146. Fat emulsions are frequently administered as part of a total perinatal nutrition. Which statement is true regarding fat emulsions? A. They have a high energy to fluid volume ratio. B. Even though hypotonic, they are well tolerated. C. They are a basic solution secondary to the addition of sodium hydroxide and AOH. D. The pH is alkaline, making them compatible with most medications. Answer A. Explanation. They have a high energy to fluid volume ratio. Fat emulsions are formulated in 10%, 20%, and 30% solutions and supply 1.1, 2, and 3 kilocalories respectively for each milliliter. A milliliter of 5% dextrose only supplies 0.17 kilocalories. Choices 3, 4, and 2 are incorrect because fat emulsions are essentially pH neutral and isotonic. Pharmacological therapies. Question 147. What is the primary theory that explains a family concept of health and illness? A. Health belief model. B. Education score completing factor. C. Family health expert factor. D. Disconnected family factor. Answer A. Explanation. The health belief model describes readiness factors, the perceived feelings of susceptibility and seriousness of the health problem, the threat, and positive motivation to maintain, regain, or attain wellness, health promotion, and maintenance. Question 148. The most common cause of injury from a house fire is A. Explosion. B. Falls from second-story windows. C. Thermal damage to skin and body surfaces. D. Inhalation injury. Answer D. Explanation. Inhalation is the most common cause of injury from a house fire. Accident prevention. Question 149. Legal protection of confidentiality. A. Extends only to written documentation. B. Extends to the electronic dissemination of information not identifiable to a specific client. C. Is important only within the court system. D. Extends to both written and verbal information. Answer D. Explanation. Legal protection of confidentiality extends to both written and verbal information identifiable as individual private health information. Coordinated care. Question 150. A 45-year-old client with type 1 diabetes is in need of support services upon discharge from a skilled rehabilitation unit. Which of the following services is an example of a skilled support service? A. Shopping for groceries. B. House cleaning. C. Transportation to physician's visits. D. Medication instruction. Answer D. Explanation. The only skilled service listed is medication instruction. Grocery shopping, house cleaning services, and transportation services are all examples of unskilled services offered by volunteer and fee-for-service agencies. Coordinated care. Thank you for watching.